And the other thing that jumps out to me too, as we start cutting calories in the long term, is the impact on the basal metabolic rate.
Yeah, that's very well known. So almost every study in the last 50 years has shown that if you simply follow a calorie-reduced diet by cutting out fat for the most part, that was the sort of classic strategy for so many years, your body simply reduces the calorie it burns. So if you eat, and this is the whole thing. People talk about thermodynamics. Anybody who talks about that doesn't really understand what's going on. Imagine that you're eating 2,000 calories, burning 2,000 calories, right? So now you say, I'm going to cut fat. I'm going to take 1,500 calories. Therefore, I'm going to lose weight. It's like, no, you might lose weight or you might not. So if you cut it down to 1,500 calories, every single study we've done in the last sort of 100 years shows that your body will now burn fewer calories. So now you're eating 1,500 and burning 1,500. You're not losing weight. And that has nothing to do with thermodynamics. People say, oh, cut your calories, it's all thermodynamics. You're completely wrong, because if you cut your calories to 1,500 and your body cuts how much it's burning to 1,500, you're still not losing weight. So it's not thermodynamics. That has nothing to do with it. It's about physiology and how your metabolic rate goes down. We know that cutting calories in that situation definitely does, because that wasn't the ultimate cause. It wasn't the root cause. It's about the insulin, right? If you drop your insulin lower, then generally your body, doesn't want to hang on, because insulin tells your body to store more fat, store energy. So if you have less insulin, you're going to store less energy, which is body fat.
Well, let's move into the third tool, which is the best way to drop insulin, intermittent fasting.
Yeah.
So for somebody that wants to adopt this as a method of, again, taking that sugar built up in the body and releasing it, how do they begin?
You can start by cutting out snacks, and then you can gradually lengthen your fasting period to longer and longer. So you can go 16 hours, you can go 18 hours, you can go 24 hours, you can go longer if you wanted to. Because again, if your blood glucose is high, and again, this is in the situation where you're overweight, where it's type 2 diabetes, not type 1 diabetes, as long as you have lots of sugar, then your body has an ample store of energy. So why are you putting more energy into your body when you actually have too much energy? Right? So if you simply don't eat, your body needs to burn that glucose for energy. If it burns the glucose, then that's good, right? You're burning down that sugar bowl. And the thing is that it's very flexible. So you can do whatever you really feel is appropriate. You can do 16 hours, you can do 20 hours, you can do 24 hours, you can do 2 days, you could do 4 days, you could do 7 days. You could, do it sometimes and not do it sometimes. You could do it only when you're gaining weight, right? If you had a vacation and you gain weight, then you can do more. If you're if you're at a good weight, then you can do less. So it's sort of infinitely flexible. And really it's a tool that people can use to control their type 2 diabetes. And it's really because fasting means eating zero. And you can't go lower than zero. It's really the most powerful tool that we have. Really, there is no more powerful tool. The question is, how much do you need to do, right? And that's all going to vary. Like, you have to see your own results. If 16-8 does fine for you, then do 16-8. If it's not doing fine for you, do more, right? If twice a week is not enough, you can do 4 days a week, right? You have to individualize it to yourself. There's no sort of one size fits all.
For somebody that may still be hung up on the basal metabolic rate that we were talking about before, let's pull that into the fasting conversation. So for somebody now that is, say, theoretically, they could be eating the same amount of calories as they were before, they're just condensing that eating window and having them within 6 or 8 hours. So talk about basal metabolic rate in that case. And we already went into it on calorie restriction.
Yeah, so basal metabolic rate doesn't tend to go down as much, because when you're not eating, when you're fasting, your body actually increases its sympathetic tone. So noradrenaline goes up. So therefore, it's going to keep your metabolic rate relatively preserved compared to simple calorie restriction. So if you look at If you take somebody and you fast them for 4 days, for example, and they've done this study, they measure their metabolic rate before fasting, so at time 0, and then 4 days of 0 food, they measure again how many calories they're burning in a day. And it didn't go down, it actually went up by 10%. So your body's actually burning more calories in the fasted state, simply because of these other hormones. So again, if you're keeping your metabolic rate high, and you're trying to lose weight, that's a huge advantage in trying to lose weight compared to calorie restriction, where we know that metabolic rate is going to drift down from 2,000 calories, which you started, and it's going to drift down. And that's how people, I've seen lots of people who have measured their metabolic rate, for example. And a lot of people who have had these yo-yo diets for so many years, they're sitting like 1,000 calories, 1,200 calories a day. It's extremely low. They're cold a lot. They don't have a lot of energy because they're not burning a lot of calories. And the problem is that the way they went, about losing the weight, which is cutting down the fat, calorie restriction, their bodies basically shut down along with their caloric restriction. So, and again, there's been multiple studies which show that anytime you decrease calories, just calories, like, the amount of calories that you're going to burn is also going to go down. So you can go very low. Like if you think you can go down to 1,000, that's very little. It's like very little food. And people say, well, how can you be gaining weight on that little food? It's like, yeah, because their metabolic rate went down even more. Right? That's the only way it actually happens. So yeah, that drop in metabolic rate can be very, very severe, and it can be a huge detriment in terms of that. So intermittent fasting is a very good way to keep that up. Same thing with low carb, because you don't necessarily have to restrict calories.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
Insulin's pushing harder, it's pushing harder, but at some point it reaches its limit, and then no matter how hard insulin pushes, you can't shove any more glucose into that cell, and therefore that's when the glucose winds up in